Emily was born 8 weeks early. She spent 30 days in the NICU as a baby, but after that, she has grown and prospered. She's always been a very outgoing, outspoken child who nothing slowed her down, that her self-confidence was high. Her motivation was ready to rock and roll. Let's take on this challenge, let's take on that challenge. The first time we truly noticed something wrong with Emily's health was a couple of days after we went roller skating. She ended up with a big knot underneath her right kneecap. We took action and saw orthopedists and MRIs. Emily was diagnosed with Ewing sarcoma in the right tibia of her leg. The tumor was inside the bone, which affects the bone and the soft tissue around it.
I just called my best friend and said, "Hey, I got cancer. Can you come over?" I was like, my cousins, my friends, my parents, they need me, and my dog. They gotta have me. If they don't have me, they're gonna be a wreck.
Emily is a patient of mine that was diagnosed in 2019 with a Ewing sarcoma, which is one of the more common bone tumors that we see in children. Her treatment required very intensive chemotherapy as well as surgery to remove her tumor. Ultimately, the surgery she required was amputation of her lower leg.
It took us a little while to accept, which of course we all resisted. There was a great deal of sadness. Overall, she handled it like a champ, which I'm very proud of her for, because she handled most days better than I probably ever would have, especially at that age.
Emily, due to her amputation, had basically to learn how to walk again. During her treatments, because she had to be in a bed a lot, she lost a lot of strength. And then after a period of time of healing, she was fitted with a prosthesis, and she basically had to learn how to walk on that prosthesis. And that's where physical therapy was extremely important in her care. Emily had a very, very difficult journey with her cancer treatment, but she is a wonderful kid and has a lot of heart and is very tough. And her family was super supportive and helped her get through it. And now she is in a really good place. And when she comes to see us and is walking on her prosthetic leg and she's all smiles and happy and doing so well, it really warms our heart. Emily is doing very well now and has no evidence of cancer at this time.
Emily is currently in her status of recovery. She is walking and learning to accept new challenges in her prosthesis. She's also still in her every 3-month oncology appointments. She is doing great.
Here at Prisma Health Children's Hospital of the Midlands, we have a pediatric hematology and oncology center. We provide care to children in the Midlands and around South Carolina who have blood disorders and also who have cancer. We're a multidisciplinary clinic, so we provide oncology care through a physician. We have nurses who are trained in administering chemotherapy. We have Child Life, whose area of expertise is taking care of children with cancer and blood disorders. We have a psychosocial team. We have a whole staff that is responsible and cares significantly about our patients and their families and helping them get through what is a very, very tough journey.
I am back to walking, swimming. I went parasailing. I've gone bowling. My care at Prisma Health was the best that I could have imagined. It was nice because I had the greatest nurses, the best doctors, and best friends that I could have met.